my name is Maneet and I am a third-year medical student at St. George's University School of Medicine. And I thought I would just make a video outlining how it was structured, what a day-to-day schedule looks like, and how I studied, and just anything else that I think may be helpful for someone starting their psychiatry rotation. So psychiatry is 6 weeks long. In terms of what a day-to-day schedule looks like, I would start anywhere from 8 a.m. to about 9:30 a.m. depending on which attending I was with. And once we got to the hospital for the shift, it was a combination of pre-charting, then pre-rounding, then either attending a treatment meeting or rounding with a resident, and then rounding with the attending and writing notes. So the exact order of this was very just dependent on the attending I was with, because different attendings had their treatment meetings at different times. So for example, for one of my attendings, we were expected to pre-chart and pre-round, then we'd have treatment meeting. Then after the treatment meeting, we would round on the patients, and we would go write our notes, and then we would round with the attending. And so this is what shifts look like when I was on the behavioral health unit. When I was on consult or ED, it was a little bit different because there was no treatment meeting. So a lot of the time, the residents would tell us which patients we needed to see. So we'd pre-chart and pre-round, then go see the patient, then do our notes and go over everything with the resident. So I was on the behavioral health unit for 4 weeks, and then I was on consult and ED service for 2 weeks. It was a Monday to Friday schedule, starting at about 8 to 9:30 depending on which attending or service you were on, and then ending anywhere from about 11 to like 3-4 p.m. So it just depended on like the service, the attending, the exact like schedule of the day, how many patients we had. But it was nice exposure to be able to see the behavioral health unit, which was the inpatient psych ward, but then also to see consult and ED. So in consult service, we were just on the floors and consulting on any patient that needed psych to see them. So it was nice to see both things and get exposure to both. In terms of how I studied and the resources I used for psych, it was pretty standard like the other rotations. I found that psych had the least number of UWorld questions that were needed to be completed in comparison to the other 5 core rotations that SGU requires you to do. So like all other rotations, SGU assigned you weekly AMBOSS quizzes, so I would do those on the weekends and then review those on the weekends. And then for UWorld, I believe for psychiatry there was 3 to 350 questions. I can't remember the exact number, but essentially before the rotation started, I just went through and divided it to make sure that I would be done about week 3, week 4. And my last 2 weeks I would have just to review my incorrects and do content review and do NBMEs. So that's how I did my UWorld. And then moving on to how I reviewed my UWorld, this was very similar to everything else. So I would do my UWorld system by system or like topic by topic. I know for psychiatry within psych there was so many different subtopics. I would do my UWorld topic by topic. And then in terms of how I reviewed everything, I had a Google Doc, and so I would do like the name of the disease and risk factors, symptoms, diagnostic criteria, if there was any imaging or lab, treatment, any side effects. So one thing to be very mindful of when you are doing psychiatry is that treatment, medication, and side effects make a very, very big chunk of the exam. So although it may seem like there's not as many diseases that you need to know, there are quite a few side effects and medications to be aware of, because this is what NBME will like to test you on your shelf exam. So it's just something to be mindful about, and also be very mindful of like timelines. So if someone has PTSD, when does that start? If someone has acute stress disorder, when does that start? Make sure you know the timelines. So like if it's between like 1 day and 1 month, or 6 months or 2 weeks, make sure you know this, because this is how they will test you and try to trip you up on the exam. In terms of reviewing UWorld, it's exactly how I reviewed UWorld for my previous rotations. So I had the Google Doc, organized subject by subject, disease by disease. Within every disease, it was like risk factor, symptoms, diagnostic criteria, treatment, any side effect. If there is a side effect of a medication, what do you give instead of that medication? So like make sure you know these things, because this is how the psych shelf likes to examine. Once again, treatment, make sure you know when to give what, which patient can have what, contraindication, side effect. If there is a side effect, what medication would you give instead? Make sure you know timeline, because timeline is so important, because that is how they will try to trip you up on the exam. That's UWorld. So I did about 2 to 3 passes of UWorld. 4th pass of content was with Melman. So I would annotate his high yield psych bullet points document. For Anki, I divided it again at the start of the rotation to make sure that I would be done all new cards by about week 3 or week 4. So my last 2 were just going through reviews. NBME I did during the last week, felt confident with the content. And then in terms of any review videos, so when there was a few days leading up to my exam, I watched the Dr. High Yield Psychiatry video. I thought that this did a very good job going over high yield topics, things that you must know, and just little details and things to be mindful of for the exam. So now in terms of how you're going to be examined. So you have your mid-core exam. So again, it's going to be on the 4th Monday of your rotation. It'll be done at home on Exemplify. It's 110 questions. You have 2 hours and 45 minutes to do it. In terms of what they will ask you on your mid-core exam, I would follow your AMBOSS schedule. Use UWorld to study, but make sure you're covering the topics that were covered in AMBOSS leading up to your shelf exam. Then you have your shelf exam. So this exam is done at a Prometric center. SGU will email you your permit. It's 110 questions, 2 hours and 45 minutes long. Then you'll have 3 SOAP notes, a handful of patient encounter log, a few modules, and some feedback forms that you are required to complete for the rotation. Again, for these things, please refer to your syllabus on Sakai to make sure you meet all the requirements and you have the exact number completed for each thing. So with that being said, that's everything that I have for psychiatry. I hope that this video was helpful, and I hope that this answers any questions that you may have going into your psychiatry rotation. If you have any other questions, or if you'd like any sort of clarification, please know that you can always reach out to me. I am always more than happy to help. With that being said, remember that you are so capable, you are so intelligent, you've made it this far for a reason, and you are going to make an excellent physician. Bye!